Infertility is a loss. It's the loss of a dream. It's the loss of an assumed future. And like every loss, it will be grieved. Fertility problems are sometimes called subfertility or infertility, but these two are different. Subfertility is a delay in conceiving. It is said to exist when pregnancy has not occurred after at least 1 year of engaging in unprotected coitus. So when we say subfertility, ito yung delay yung pagbubuntis ng isang babae. Pwedeng may anak na siya or nabuntis na siya nung una but at the second time around, delay na o wala na talagang nangyayaring conceiving. Or may kakayahan nga siyang makapag-conceive pero less yung chance. So we have primary subfertility and secondary subfertility. The primary subfertility has been no previous conception. It means hindi talaga nakaranas ng pagbubuntis yung babae or never talaga siyang nabuntis. While in secondary subfertility, it has been a previous viable pregnancy that the couple is unable to conceive at present. So meaning, yung babae nabuntis siya noon and at the present, hindi siya makakapag-conceive or mabubuntis. Sterility is the inability to conceive because of a known condition such as absence of uterus. So when we say sterility, incapable siya to conceive. Walang fertilization na nangyayari and so walang mapo-form na offspring or mapoproduce na offspring. There are different factors why sterility occurred, including tubal factor, cervical factor, uterine factor, endocrine factor, testicular factor, and sperm factor. While infertility, incapable siya to carry pregnancy due to some problems sa fertilization ng egg cell and sperm cell. And kagaya ng sinabi ko kanina, yung subfertility is capable siya to conceive but delay lang siya or more difficult. Nursing care planning to empower a family. First is determine the time of ovulation. You can be able to determine the time of your ovulation through basal body temperature and analysis cervical secretions. This basal body temperature will help you to predict when you will ovulate. Sa yung babae, magiging fertile siya during 2 to 3 days before tumaas yung body temperature niya. On the other hand, the analysis of cervical secretions can help you to predict ovulation by tracking and checking if there is any changes in your cervical mucus. So kapag sticky and dry yung mucus, then you are not fertile. But when it's cloudy, stretchy, and slippery, then you are fertile. Next is men need sperm recovery time after ejaculation. It is to maintain an adequate sperm count. This is why coitus every other day rather than every day. During the fertile period will probably yield faster results. The male superior position is the best position for coitus. It is to achieve conception because it places closest to the cervical opening. The male superior position is also known as missionary position. The male should try for deep penetration so ejaculation places sperm as close as possible to the cervix. Elevating a woman's hips on a small pillow can facilitate sperm being deposited near the opening to the cervix. A woman should remain on her back with knees thrown up for at least 20 minutes after ejaculation to help sperm remain near the cervix. Don't use touching or lubricants before or after intercourse, so vaginal pH is unaltered, which can interfere with sperm mobility. Eat a diet high in slowly digested carbohydrates, low in saturated or trans fat, and moderate in protein. And maintain a body weight that results in a body mass index between 18.5 and 24.9. And of course, you need to exercise about 30 minutes per day to help keep blood glucose and insulin levels stabilized. And last, choose a new activity that the two of you can do together, such as learning ballroom dance, so you can create an activity separate from planning a baby. This is not only helped to pass the time in a positive way, but also offers a positive outlook for a month when you don't conceive. Fertility assessment. The age of a couple and the degree of apprehension they feel about possible subfertility can make a difference in determining when they should be referred for fertility evaluation. Although some healthcare plans or specific settings set limits on the age range in which fertility testing can be scheduled, such as not before age 18 years and not after age 45 years. Other settings do not establish such limits, allowing couples of any age to benefit from assessment. These are the following that you need to assess in men health history.
His general health. A typical 21 hours food intake, including alternative therapies such as herbs, and whether he ingests alcohol, uses recreational drugs, or smokes or uses tobacco. If he had a congenital heart problem such as hypospadias or cryptorchidism, or a past illness such as mumps or orchitis, urinary tract infection, or sexually transmitted disease that could affect fertility. If he had a radiation to his test because of childhood cancer, x-rays, or an industrial accident. If he had an operation such as surgical repair of hernia or torsion of the testes, which could have compromised the blood supply to his testes. If he had any current illness, particularly an endocrine or a low-grade infection. If his job or lifestyle involves sitting all day, what his sexual practices are, such as frequency of coitus, masturbation, coital position used, or if he ever experienced failure to achieve ejaculation. What past contraceptive measure, if any, he had used, or if he has a children from previous relationship.
Next, the women health history. First, you have to ask about past pregnancies, miscarriage, or abortion, history of contraceptive use, current or past reproductive tract problems such as infections, overall health, emphasizing endocrine problems such as galactorrhea, abdominal or pelvic operations that could have compromised blood flow to pelvic organs, past history of a childhood cancer treated with radiation that might have reduced ovarian function, the use of Dutchess or intravaginal medications or sprays that could interfere with vaginal pH, exposure to occupational hazards such as x-rays or toxic substances, nutrition including an adequate source of folic acid and avoidance of trans fats, and if she can detect ovulation through such symptoms as breast tenderness, mid-cycle, wetness, or lower abdominal pain.
Physical assessment. Both men and women need a complete physical examination. In men, pubic hair.
The pubic hair should be present because it reduces friction during the sexual intercourse and it prevents dirt or bacteria from entering the genital. And of course, there should no genital abnormalities such as absence of vas deferens or the presence of varicocele. So for women, a woman should undergo breast and thyroid examination. It is necessary to rule out current illness.
The thyroid examination is important as it's often the first step towards diagnosing thyroid diseases such as Graves' disease, Hashimoto's thyroiditis, and multinodular goiter. Both inspection and palpation are important aspects of the thyroid examination. Complete pelvic examination. It includes vulva, vagina, cervix, ovaries, uterus, rectum, and pelvis for any abnormalities. Pap test is often performed during a pelvic examination. It is a screen for cervical cancer.
Fertility testing. Basic fertility testing is geared toward answering 3 questions. So may tinatawag tayong basic fertility testing, which is may 3 question na ito-throw sa ating client na dapat din nilang sagutan. So the first question is there sperm of good quality and number available? So dito yung titingnan natin is yung quantity niya or yung volume ng sperm, the motility ng sperm or yung movement niya kung normal ba, and the shape of the sperm. So next is, are ova or eggs available or woman is ovulating? So dito, titingnan natin if nag-ovulate yung woman or makakapag-produce or capable siya to produce egg cell. And last, is it capable for the sperm and egg to mate in a receptive environment? Kailangan din nating malaman if capable ba yung sperm and egg cell na mag-meet in the right place, which is sa fallopian tube sila nagmi-meet for them to fertilize.
Causes of low sperm count. First, high temperatures. Sitting for long periods, wearing tight clothing or working on a laptop computer for long stretches of time might increase the temperature in your scrotum and slightly reduce sperm production. Second, medical treatments. Certain medications such as cancer drugs, ulcer medicines, and blood pressures medications are impair sperm production and reduce fertility. Third, infection. Sexual transmitted infections such as the HIV, gonorrhea, etc. can cause blockage of sperm pathways leading to low sperm count. Lastly, undescended testicles is a condition when one or both of the testes have not descended into the scrotum at birth, but stay in the abdomen or only move halfway down. What's normal? Sperm count can be important if you're trying to conceive a child. An abnormal sperm count may also indicate an underlying health condition. A normal sperm count ranges from 15 million sperm to more than 200 million sperm per milliliter of semen. Anything less than 15 million sperm per milliliter or 39 million sperm per ejaculate is considered low. A low sperm count is often referred to as oligospermia. A high or above average sperm count is over 200 million sperm per millimeter. You can determine your sperm count through a semen analysis. You can get the analysis done at your doctor's office, a fertility clinic, or with an at-home test. How is semen analysis conducted? You'll need to provide your doctor with a semen sample for a semen analysis. There are 4 main ways to collect a semen sample. First, masturbation. Second, sex with a condom. Third, sex with withdrawal before ejaculation. Lastly, ejaculation stimulated by electricity. Masturbation is considered the preferred way to get a clean sample.
The therapy for increasing sperm count and motility. So first, if sperm are present but total count is low, a man may be advised to abstain from coercious or sexual intercourse for 7 to 10 days at a time to increase the count. So guys, ibig sabihin dito is kung ang sperm ng lalaki ay present pero mababa ang kanyang na-collect, give advice or bigyan mo siya ng advice na huwag munang makipagtalik into 7 to 10 days para mas marami siyang makolek na sperm. Ligation of a varicocele if present and change in a lifestyle such as wearing loosened clothes, avoid long period of sitting, and avoid prolonged hot bath may also help for reduce scrotal heat and increase the sperm count. So let's proceed to the obstruction or impaired sperm mobility. First, in some men, adequate sperm are manufactured, but there is obstruction at the same point along the pathway spermatozoa must travel to reach outside. The semiphoros tubulus, the epididymis, the vas deferens, the ejaculatory duct, or the urethra. So, ibig sabihin guys, ilan daw sa mga lalaki ay may sapat na sperm ang nagagawa but may mga hadlang sa dinadaanan ng spermatozoa para makapag-travel sa labas ng seminiferous difference and the vas difference and the ejaculatory duct or the urethra.